Knock, knock, knock. Hi, my name is Natalie. I'm a student nurse from Kilgore College, and today I'm going to be assessing your range of motion and your muscles. Is that okay?
Mm-hmm.
All right, hand hygiene. Can I verify your name and date of birth?
Allison, June 23rd, 2005.
Okay, perfect. Do you have any allergies, Miss Allison?
Mm-hmm.
All right, so I'm going to start by taking your vitals, and I'm going to ask you a few questions while I do that. Have you had anything to eat or drink in the past, or smoke in the past 30 minutes?
No.
Okay, I'm going to go ahead and take your temperature. Could you tell me where you're at today?
Kilgore Hospital.
Okay, and what brought you in today?
Just an assessment.
All right, and what year is it?
2025.
All right, what time of day is it?
It is like 7 p.m.
Okay, your temperature is 97.8. Could you go ahead and roll this sleeve up? I'm gonna go ahead and roll this sleeve up for you.
Oh yeah, that's fine.
All right, could you tell me what your nutrition's like in a day and what you eat?
I normally eat a banana, some other fruits, like probably granola bar, some chicken, or some other type of protein, and some chips.
Okay. Could you tell me your height and weight?
I'm 5'1", 128 pounds.
Okay, and on a scale of 0 being no pain and 10 being the worst pain of your life, what would you rate your pain?
A 0.
Okay, perfect. Your pulse was 72, it was +2, and it was regular. Your oxygen is 98%, and your respirations were 12. They were even and unlabored. I'm going to go ahead and clean all of my materials. Make sure I clean everything before I use my blood pressure cuff and my stethoscope. Do you have a preference on which arm do you like it taken on?
No.
Okay, could you tell me about what your normal blood pressure runs around?
It's normally like 110 over like 68.
Okay. Okay, I got 110 over 64. I take this off and clean it, clean my stethoscope and all my other materials. Okay, Miss Allison, do you have any assistive devices that you use?
Mm-mm.
Okay, so first off, I'm going to start with you standing up. Okay, now you're going to take just a couple heel to toe steps. Okay, perfect. Now take just a couple steps back. I'm going to have you take your heel of one of your feet and rub it down your shin, then slide the other foot down the shin. Okay, perfect. Now you're going to follow exactly what I do with my fingers, okay? Perfect. Okay, now you're going to follow what I do with my lower extremities. You're going to put your feet together, do a squat. Okay, now raise one knee up, out, back in, out to the side, out to the back. Perfect. Other leg, out, back in, out to the side, out to the back. Perfect. Okay, now I'm going to assess your spine, so I'm going to be needing you to touch your toes if you can, okay? Go ahead. Perfect. No curvature is noted in your spine. Now I'm going to have you follow exactly what I do in my upper extremities. Okay, one big circle, and then one big circle backwards. Perfect. Now I'm going to be assessing your muscle strength, okay? So I'm going to press down on your shoulders, and you're just going to shrug. Okay, perfect. Now you're going to pull on my hands. Now push. Okay, now push, pull. Perfect. Now I'm going to wash my hands, and I'm going to be touching your face if that's okay. Okay, I'm going to be putting my hand on your cheek, and you're just going to look to your left and look to your right. Okay, perfect. Now I'm going to be putting it in the same place, and you're just going to put your ear to your shoulder. Okay, perfect. Now I'm putting my hand on your forehead, press forward. Now press back. Perfect, perfect. All right, I'm going to have you look up, look down, look to your left, look to your right. Do one big circle for me. All right, Miss Allison, I'm going to have you go ahead and take a seat back on the table. All right, go ahead and roll your sleeves up and roll up your pants for me if you could. Okay, I'm just going to assess your pulses. +2 in the regular. Now flip your hands for me. Now you're gonna spread them wide, close them. Okay, now open them just one more time. Okay, now I'm just gonna be pressing down on your fingernails a little bit. Okay, now go ahead and squeeze my fingers. Okay, perfect. Now roll these up just a little bit for me if you can. Okay, I'm gonna be assessing your pulses behind your knees. Okay, they're +2 and regular. Feel your temperature. I'm gonna just press down on your legs, down your shins, just to test for edema. Okay, go down and test your pulses. Okay, they're +2 and regular. And test your pulses on the inside. Okay, +2 and regular. Now I'm gonna have you spread your toes nice and wide for me. Okay, perfect. Now I'm gonna press down on your toenails just a little bit. Okay, perfect. Now point your toes for me. Now flex them up towards you. Point your toes again. Okay, flex them up. Okay, perfect. Now I'm gonna pull these back down for you. Is there anything else that I can do for you, Miss Allison? Are you in a comfortable position? Okay, here's your call light. The provider or the doctor will be in just a few minutes, okay? And hygiene, and I'm gonna document. Patient was alert and oriented, ×4 to person, place, time, and situation. Patient was calm and collected. Skin was appropriate for ethnicity. No lumps or bumps noted. Patient was well groomed. No problems with hygiene. Patient's nutrition was adequate. Patient rated their pain as 0 out of 10. Patient had full range of motion in the upper and lower extremities bilaterally. Patient had full muscle strength in the upper and lower extremities bilaterally. Against resistance, patient also had a strong grip on both of her hands bilaterally. Patient's capillary refill was less than 3 seconds on upper and lower extremities bilaterally. Patient had no problems with gait or coordination. Patient had no assistive devices noted. Patient had skin that was warm to the touch on the lower extremities. No edema noted on the lower extremities bilaterally. Patient radial pulse was +2 and regular. Patient's posterior tibial pulse was +2 and regular. Patient's popliteal pulse was +2 and regular. And their dorsalis pedis pulse was +2 and regular. And there were no other abnormal findings. During my assessment, patient was left in a comfortable position with the bed in the lowest position and call light within place. Assessment complete.